A woman had constant headaches, swollen gums, and chest pressure, but every test pointed somewhere else. Then one dentist looked inside her mouth and found the hidden problem. This video promised to reveal the danger hiding in your teeth, and that is exactly where we are starting. But here is the scary part: your mouth may look normal while bacteria quietly spread through your body. Comment where you are watching from and hit like if you care about your health, because the first warning sign might already be sitting under your gums. Most people think their mouth is separate from the rest of the body. They brush, rinse, eat, and move on. But your mouth is not separate. It is the entrance to your gut, your blood system, and your whole health. Every bite of food starts in the mouth. Every drink passes through it. Every night, bacteria can build on the teeth, gums, and tongue. If this buildup is ignored, it can turn into plaque, gum swelling, tooth decay, and deeper infection. Now here is what makes this dangerous. The mouth has blood vessels, nerves, and soft tissue. When gums are inflamed or infected, bacteria may enter the bloodstream. Once that happens, the problem is no longer only dental. It can affect other areas of the body. This is why oral health has been linked with heart problems, inflammation, and other serious conditions. It does not mean every cavity causes disease. But it does mean a sick mouth can place stress on the body. Think about bleeding gums. Many people see blood when brushing and ignore it. But bleeding is a sign that the gums are irritated. If the gums keep bleeding, bacteria have a better chance to move deeper. Bad breath can also be a warning. So can loose teeth, pain when chewing, swelling, pus, or a strange taste in the mouth. These are not small things. They are messages from the body. But one of the biggest mistakes people make is waiting until they feel pain. Pain is not always the first sign. Sometimes infection grows quietly. A tooth can look fine from the outside while deeper tissue is struggling. That is why regular dental checks matter. Not just for a bright smile, but for your whole body. And this is where the story gets darker. Because sometimes the problem is not the tooth you can see. Sometimes it is what is hiding underneath. A person can have an old dental procedure and feel nothing for years. No pain. No swelling. No clear sign. Then suddenly, health problems appear somewhere else. This is why some people worry about hidden infections around old root canals, extractions, implants, or damaged teeth. In some cases, bacteria can remain trapped in deep tissue or around the jawbone. If that area becomes infected, the body has to keep fighting it. That constant fight can drain energy. It may increase inflammation. It may also stress the immune system. And when the body is always fighting something, other systems can suffer. Now, this does not mean every root canal or dental implant is dangerous. Many people have dental work and do well. But it does mean old dental work should not be ignored, especially if symptoms keep coming back and no one can explain why. If you have chronic sinus issues, jaw pain, swollen gums, recurring infections, or strange pressure in the face, your mouth deserves attention. If you have an old tooth that feels dead, dark, sensitive, or infected, do not pretend it is normal. If you are still watching, subscribe now, because the next part explains what most people never connect. Your teeth are alive in a way many people do not understand. They are not just hard white stones. Inside each tooth are tiny channels, nerves, and blood supply. The gums and bone around the teeth also play a role in keeping the mouth healthy. When decay reaches deep enough, bacteria can move into areas that are harder to clean. Once infection gets into deeper spaces, brushing alone may not fix it. That is when proper dental care becomes important. This is also why gum health matters so much. Gum disease can create pockets around the teeth. These pockets trap bacteria. The deeper the pocket, the harder it is to clean at home. And once bacteria settle there, they can keep creating inflammation. So the mouth becomes a hidden battlefield. But the next problem is even more common. Because many people are feeding the bacteria every single day without knowing it. Sugar is one of the biggest enemies of oral health. Soft drinks, candy, sweet snacks, fruit juice, and processed foods can feed harmful bacteria in the mouth. These bacteria produce acids that weaken enamel and irritate the gums. But sugar is not the only issue. Sticky foods, refined carbs, and frequent snacking can also keep the mouth under attack. If your teeth are exposed to food all day, bacteria keep getting fuel. Over time, enamel weakens. Plaque hardens. Gums swell. Breath changes. Teeth become sensitive. Then decay begins. And here is the part many people miss: your mouth also changes based on your habits. Mouth breathing can dry it out. A dry mouth has less saliva. Saliva helps protect teeth, wash away food particles, and balance acids. Without enough saliva, bacteria can grow faster. That means sleeping with your mouth open, not drinking enough water, or using products that dry the mouth may make things worse. Your tongue also matters. A coated tongue can hold bacteria, yeast, and odor. If you brush your teeth but never clean your tongue, you may leave behind a major source of buildup. So the real goal is not just white teeth. The goal is a clean mouth, healthy gums, fresh breath, and strong oral balance. Now here is the best point. Your mouth can improve when your daily routine improves. Start with brushing twice a day using safe toothpaste. Brush gently at the gum line, not just the surface of the teeth. Use small circles. Do not scrub like you are cleaning a floor. Your gums are soft tissue. Floss once a day. This removes food and plaque between teeth, where a brush cannot reach. If floss is hard for you, a water flosser can help. Clean your tongue daily with a tongue scraper or toothbrush. Drink water often. Reduce sugary drinks. Eat more whole foods. Add crunchy fruits and vegetables when possible, because chewing supports saliva flow. But there is one more step. Because cleaning your mouth at home is powerful, but it cannot replace what a trained professional can see. If you have bleeding gums, loose teeth, swelling, tooth pain, bad breath that will not go away, or an old dental problem, get checked by a qualified dentist. This is not something to guess about. A dentist can look for cavities, gum disease, infection, bone loss, and hidden problems. In some cases, X-rays or deeper exams may be needed. If you already have health issues and no clear cause, it may be worth asking whether your oral health could be playing a role. This does not mean your mouth is the cause of every illness. But it does mean your mouth should be part of the conversation. Many people spend money on supplements, diets, and health plans while ignoring bleeding gums and infected teeth. That is like cleaning your house while leaving trash under the bed. The mouth is one of the first places to check because it is used every day. You eat with it. You breathe through it. You speak with it. And bacteria live there constantly. Now think about what you learned. A healthy mouth is not just about looks. It is about lowering bacteria, calming inflammation, protecting gums, and supporting the whole body. And here is the truth most people ignore. Knowing this means nothing unless you act. Do not wait for pain. Do not wait for swelling. Do not wait until a small problem becomes expensive and serious. Start with simple daily care. Brush properly. Floss daily. Clean your tongue. Drink water. Limit sugar. Eat real food. Visit a dentist when needed. Small steps done daily can protect you for years. And once your mouth becomes healthier, your whole body may thank you. There is one thing I did not mention at the start. Your smile may be showing clues about your health before your body screams for help. Watch the next video now. It shows the daily mouth routine that can protect your teeth and gums. Your health starts with your next habit.